Welcome back to Sanctified Outcast, the Watchwoman's Table. I go by Kalira, and this is episode 2 of the Refiner's Fire series. This episode is called When the Watchwoman Becomes the Patient. Now, I'm going to take my time on this episode because the chemotherapy side effects and the symptoms are getting to me. But I just keep pushing through. But as you know, in the first episode, I talked about renaming the Red Devil and choosing to call it the Refiner's Fire. But this episode is a little bit different because now I am not just talking about the fire. I actually had to walk into it. Since the last episode, I had my port surgery, I received my first chemo dose, and I started experiencing what it means to be a watchwoman who is also a patient. And honestly, that is humbling in a way because I did not fully expect. Because it's one thing to say fear does not get naming rights over my healing. However, it's another thing to say, I still trust you, Lord. I still trust you, God. It is one thing to say that this is the refiner's fire, but another thing to be lying in a hospital bed, wearing a surgery cap and looking around at all the nurses and the machinery and all the medical equipment and all the instructions you have to read and realizing this is like actually happening. My body is really being prepared for treatment. So that was like the moment where it just stuck with me about I'm actually going through the process. This is not just something I am processing spiritually anymore. It's something that's happening physically. And this is where this episode begins. Recently, I had my port surgery. For those who may not know, a port is placed in under your skin to help make chemotherapy treatment easier to receive. So I have my port right here. I'm not going to explain too much about it. I just want to give a little context regarding my journey. This is not medical advice. If you're a cancer patient, just go by what your oncologist says or make that decision on your own. But for me, the port surgery made everything feel real in a different way. The diagnosis was already real in the scans and all the conversations that I had with the doctors, but that port surgery was definitely the doorway into it felt like my body was being prepared to enter that treatment process. So that was like the doorway to that. And I remember lying there thinking about how strange it felt because I'm used to being the one who observes things and I discern a lot of things like spiritual climates, and I'm the one who usually prays mostly by myself in quiet peace. And I'm used to always asking the Lord, what are you trying to show me? But in that moment, I was not observing from the outside. I was the one who was in the bed, the one who was being prepped, and the one who actually needed the care. And that is where the title came from, because a watchwoman is someone who watches. We pray, we pay attention to things. But what happens when the watchwoman is the one who actually needs the care? I always say, what happens when the one who is used to standing has to lay down? And when I say we have to lay down, I have to lay down. And the one who usually prays to others. Now, most people don't realize that I'm praying for them, but I kind of just do it in secret. But now I'm the one who needs the prayer. So this is what I'm learning in real time now. And I am still a believer. I'm still called. I'm still a mother. I'm still me. But I am also a patient now. And I am learning how to accept that without shame, because needing care does not make you weak. Needing help does not make you less spiritual. Being in a hospital bed does not mean your calling has disappeared. Sometimes God teaches us in rooms we never wanted to enter. And sometimes the watchwoman has to learn that she is still called, even when she also is being cared for. So after my port surgery came the next big step, and that was my first chemotherapy dose. The thing I talked about in episode 1, the thing many people call the red devil, the thing I chose to call the refiner's fire. The thing is, as I was sitting there getting ready to receive the first treatment, I had to remind myself of what I already declared. Fear does not get naming rights over me or over this. Before receiving my first chemo dose, my husband and I held hands and we prayed together. That moment truly mattered to me because I did not just want to rename the fire. I wanted to enter it with prayer and invite God into that room, into that chair and the process, the treatment, everything involved. My emotions, my mind. Because yes, I had faith, but I was still human. I still had thoughts, emotions about everything that was going on. I still had to sit there and face reality that treatment was starting. That is something I want people to understand about faith. Faith does not mean you never feel nervous. It does not mean you never think about your children, your body, your future, and all the responsibilities that you may have or what treatment may feel like in general. Faith means those thoughts do not get to lead you. It means that fear does not get to sit on the throne. Faith means that even when your hands are shaking, you can still pray. And that prayer was not about pretending I had everything together. It was about surrender. It was about saying, Lord, I know you are here with me. And I am grateful my husband was there with me as well. Because sometimes support is not about someone having the perfect words. Sometimes it's simply having someone there to hold your hand while you pray. And that was enough for me. Now, I did have some moments with the nurses where we ended up joking about how other patients sometimes give chemo drugs different names, like how I did. Some of them were funny, some of them were very personal, many were faith-based. And she actually mentioned that one patient called one of the drugs the blood of Jesus. I'm assuming the one that was normally called the red devil, she called the blood of Jesus. And I will be honest, for me, that felt a bit too much. I was like, okay, I do not know if I would go that far. But at the same time, I understood the heart behind it. When you're sitting in that chair facing something heavy, people are trying to find a language that brings comfort. And for me, it was the refiner's fire that brought comfort to me. Now, some people, they will cope with it through humor. Some will cope through it with prayer, including just naming the drug something else. And that's exactly what I did. And some people just don't want to name it anything and just want to just get through the treatment. And that's okay. Everyone processes this differently. But for me, the name that gave me peace was the refiner's fire. Not because the drug itself is holy or anything, or because I worship the treatment, but because I'm saying that I believe that God can even use this process to remove what does not belong and strengthen what remains, which is me. Get rid of the cancer that leaves me stronger than before. I believe God can meet me in that medical room, and I believe God can be present even in places that feel scary. As I was receiving my first chemo treatment, I recorded and took some photos of the process. I have clips and photos of the 2 chemo drugs entering my body. The first one was Adriamycin, also known as doxorubicin, and that is the drug many people call the Red Devil. But for me, that was the refiner's fire. Then after that, I received the cyclophosphamide. I think that's how you say it, cyclophosphamide. At one point, I recorded a clip explaining that I had finished receiving the refiner's fire and that I was about to start the next drug, cyclophosphamide. That moment made everything feel very real. The medicine was like, I saw the red drug just slowly creeping up to me and about to enter inside my body. And that's how I knew the process was starting. And I had to stay anchored in what I already declared. Fear does not get naming rights over me or over this process. In that same clip, I also talked about having a headache and taking Tylenol. I think it was due to the nausea medication, steroids, and pre-meds they were giving me before I started the chemotherapy. And I am not saying that as medical advice because I don't know the actual cause of my headache. It could have been any of those things. I'm just sharing my experience in real time. And that is something I want to be honest about as well. Like, you can be full of faith and still have a headache. You can pray and still need Tylenol. And you can also trust God and still get nausea and need medication for it. But I also believe in healing in that I should also listen to my care team when they tell me something, especially when it comes to instructions and when to take the medication and stuff like that. It's not a contradiction to have faith in God and listen to your care team. I mean, that is wisdom. And while I was sitting there receiving chemo, I also had my laptop with me, and I was still working on this long presentation I have been working on for quite some time about exposing the kingdom of darkness, because that's what us watchwomen do. We expose the kingdom of darkness. So I would not stop that. The enemy would not stop me from exposing the kingdom of darkness. He would not. And that may sound intense to some people, but for me, it was very symbolic because I refused to let the enemy stop me from my purpose as a watchwoman. Chemo or no chemo, my assignment still belongs to God, and cancer does not get to pause my calling. Treatment does not get to silence my voice either. The enemy does not get to use this diagnosis to make me lay down my purpose either. Now, of course, I am going to rest when I need to rest because that's exactly what I did. Day 3, I was out. I slept a lot. I started feeling all that bone pain. Yes, I had to lay down. I got plenty of rest, but the fatigue does not go away. So I'm going to pray that fatigue away because I need the strength and energy to keep going. But I am going to listen to my body, and I'm going to be wise about it. But spiritually, I am still standing. And even as I was sitting in the chemo chair, even as I was hooked up for treatment, even though I'm moving slower than usual, I am still a watchwoman. I'm still called, but I just became a patient. The patient is still watching, okay? I am still watching. I'm still discerning. I'm still building things up. Nothing's going to fall apart. I'm still obeying God as well. And that is also part of my testimony because I am not the type to give up, especially when God is by my side. After receiving my first chemo dose, I started paying attention to what my body was doing. Again, this is not medical advice. This is just my personal experience. On the first day of chemo, there was a few things I noticed before the chemo started. As I said before, steroids, medications, weird, strange tingling feelings I was having. After even getting the steroids, it was pretty weird. It definitely caught me off guard, and I was not expecting that weird sensation. It was a weird sensation in a certain area of my body. I also had a headache during the infusion, and that's when I needed the Tylenol. Later on, I noticed I started getting hot flashes. I started sweating a lot, and my taste buds also changed. I hate that because I love to eat a lot of good, tasty food, but now my appetite disappeared. Everything just doesn't taste right. And also, my eyes were kind of stinging at the time of the treatment, and I also had like little throat irritation as well. There was also this medicine smell on me after the treatment and when I was at home. And yeah, my body the smell just covered the entire room. I guess it had to do with it was like a chemical smell. Yeah. Yeah, it's like my body like absorbed the treatment and the smell was just, yeah, out. That part was actually pretty strange. It was not necessarily severe, but it was like very noticeable. Luckily, on the first day, I didn't vomit. I didn't have any fevers. I'm trying to think what else. I didn't have fevers and vomiting. Everyone was actually telling me that the vomiting was actually going to be normal, but I was very on point on my medication. I made sure I took them before the sickness even hit, any type of weird feeling. But I could tell that my body has been going through something major after that chemotherapy, and this is where I had to separate faith from pretending, because sometimes faith does not mean you're ignoring your symptoms. Faith does not mean pretending that your body's not reacting to it either. So that's why I was very precise on taking my medication, and I had a set time. I'm going to take my medication first thing in the morning. Whatever the doctor told me to take, I took. But if I felt like I didn't need it, especially with 3 different nausea medications, I only took the one that was less severe because I wasn't really having extreme nausea, thankfully, on the first day. Second day, now third day, it's mostly fatigue. But faith also means that even while your body is reacting, fear does not get to control your spirit. So I had to pay attention. I listened to my body and I followed all the instructions that were given to me as well. So the medication that I took were mainly Zofran. They also gave me another one called methocyclophamide. I probably pronounced it wrong. I still haven't taken it because I didn't need it yet. I just been taking the Zofran, and that's been helping. I also took some Claritin because I had a white blood cell production injection done. And yeah, Tylenol was another thing I mainly take for like pain. And now there's other supportive medication they prescribe, like olanzapine, some Colace, But yeah, it just depends on what symptoms popped up. I didn't really have to take it, thankfully, yet. And I just want to say this clearly, that taking medication does not mean you lack faith. Using nausea medication does not mean you're not trusting God. Taking Claritin, Tylenol, all those medications that were prescribed to you, it does not mean you're weak either. Sometimes wisdom looks like prayer and medication at the same time. And also just worshiping and drinking your water and declaring that God is good while still setting timers for your nausea medication. Because sometimes you just got to praise Him when you drink your water. Enjoy it. Know that this is the living water. God is providing for me. He is there for me, and He loves me, and He cares for me. And He's good. So that's what I've been doing. Even though most of the time I'm pretty much asleep now. But that's not weakness. It's stewardship. This body is still something that God gave me, and I have the responsibility to take care of it while I walk through this treatment. So by the second day, I was still watching for the symptoms, and that's when I was experiencing the sweating the most, a lot of sweating. Because of that, you don't really know what to expect when you first start chemotherapy. Like, when I was sweating a lot, I was not expecting I was gonna sweat like that. Like, I'm talking about my entire forehead was drenched in sweat. Because you don't know what to expect, because you hear other people, what they went through, like their stories, and you read about so many things and how other people react to chemotherapy. And so part of me was like, okay, what is my body going to do? And in my case, it was a lot of sweating. But, on the second day, I was like, oh, I'm still here. I'm still functioning. I'm still going strong somewhat. And that doesn't mean that every day will be easy. It does not mean symptoms will not come as well. But it does mean that God met me in those first 2 days and this third day as well. He met me through it all. Because sometimes we only look for God in the dramatic miracles, but it's the small things where He matters the most. Because sometimes God is also in the small mercies, like the fact that I didn't have to worry about vomiting yet or having a fever. That is His mercy and that is His grace right there. The fact that my care team gave me very good instructions where I could follow and that I was able to ask questions and get the right answers, and I can just text message my oncologist and if I have a question like, what do I do if I need to do this? And he'll reply, or I need help with this or this, and he'll reply. So it's like those little small mercies right there. And the fact that I was able to be there with my husband and going through this process, and those are small mercies from God, if you think about it. The fact that I could still pray through the day, through day 1, day 2, now day 3, those things matter. And that is also part of the refining process. Not just the big spiritual declarations, but the daily moments where you keep choosing faith while also caring for your body. And that brings me to something I kept thinking about. The 3 Hebrew men in the fire. Shadrach, Meshach, and Abednego. They were thrown into a fire that was meant to destroy them. But the fire did not consume them. The fire did not finish them either. The fire became the place where God's presence was revealed. The king looked into the fire and saw a 4th man walking with them. That story has been sitting with me differently in this season. Because sometimes we want God to keep us from ever entering the fire, and I understand that. I would have loved to never have cancer and to never have to go through chemo or this port surgery I had. I would have loved to never had to explain this to anyone. But sometimes the testimony is not that you never entered the fire. Sometimes the testimony is that you entered the fire and you were not alone. Sometimes what was meant to destroy you only reveals that God is with you. And sometimes the fire burns off what had you bound. And sometimes the fire exposes who is really walking with you. And that is how I'm choosing to see this season. The fire is real. The treatment is real. My emotions are very real. The diagnosis is real. But so is the refiner. And so is the one who walks with us in the fire. When I sat in that chemo chair for the first time, I had to think about everything I said in episode 1. This was the moment where my words had to become my posture. It is easy to say I will not fear, not let fear lead me. It's very easy to say that before the moment arrives. But then, when the moment arrives, the port is placed, the medicine is prepared, the nurses are there, the appointments begin, and now you have to decide if what you declared is still what you believe. And I had to remind myself, I am not calling this the red devil. I am calling it the refiner's fire. I am not giving fear authority over my healing. I am not allowing a nickname to shape my spiritual posture. I am not allowing this diagnosis to define me, and I am not allowing this treatment to become my identity. My port is not my identity, and my diagnosis is not my identity. My treatment plan is also not my identity. My life belongs to God and God alone. My healing belongs to God, and my assignment also belongs to God. And that does not mean I will never have hard days. It means that even in those hard days, I will not surrender my agreement to fear. So I want to say this to anyone listening who is newly diagnosed, preparing for surgery, or preparing for chemo or already in treatment. You are not weak because you feel afraid. You're not less faithful because you have questions. You're not failing because you need help. You're not a burden because you need care. You are not your port. You're not your diagnosis. You're not your treatment plan either. You are still loved. You are still valuable. And you are still seen. And your story is not over. Sometimes when people are strong or spiritual or used to be the one who helps others, it can be hard to receive help. It can be hard to admit that you are tired. It can be hard to admit that you're scared. It can also be hard to admit that you need someone to show up for you. But this season is teaching me that receiving care is not weakness. It is humility. It is allowing God to use people. It is allowing others to be a part of the testimony as well. And it is allowing yourself to be human. And that is something I am still learning, because life does not pause just because you get a diagnosis. You'll still always have your responsibilities, your family, your children. You still have things that you're still trying to figure out. And for me, being a mother in the middle of this adds another layer, because I am not just thinking about myself, I'm also thinking about my children, how the treatment may affect my energy levels. I think about how to show up as a mother while I'm still healing. And I think about the fact that I am postpartum and going through cancer treatment at the same time. I'm learning that faith does not require me to pretend none of that matters. Faith allows me to bring all that to God. And faith allows me to say, Lord, this is heavy, but I trust you. It allows me to be honest without being hopeless. Faith allows me to cry without even giving up. My faith allows me to say that God, even when I'm feeling weak, you are strong. And that is why this episode matters to me. Episode 1 was about renaming the fire, but episode 2 is about entering it. Episode 1 was about declaring the refiner's fire, but episode 2 is about sitting in the chair and receiving it with prayer. What I am learning is this: when the watchwoman becomes the patient, God does not remove the calling. He meets her in the room. He meets her in the hospital bed. He meets her in the chemo chair, and he meets her in the surgery prep. He meets her when she's quiet. He meets her when she don't have any words left to say. He meets me in the fire, and I believe he will continue to meet me here. This is the Refiner's Fire series, and I'm not sharing it because I have everything figured out. I'm sharing it because I'm being refined in real time. I'm sharing it because maybe someone else out there is walking through a season that they did not choose. Maybe someone else is facing treatment or a diagnosis, fear, anxiety, stress, you name it, or something that is heavy in their heart. And maybe you needed to be reminded that the fire may be real, but so is the refiner. You may be in the room, but God is there too. You may be the patient right now, but you are still called. So today I want to leave you with this. Do not be ashamed of needing care. Do not be ashamed of having questions. And do not let hard seasons convince you that your calling has been canceled. And also, do not let fear name what God can refine. This fire may be real, but so is the refiner. Thank you for sitting with me for another episode of The Watchwoman's Table. If this episode has encouraged you, don't forget to subscribe, follow, and share it with someone who may need it. This was episode 2 of the Refiner's Fire series, When the Watchwoman Becomes the Patient. I'll see you at the table.